Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
According to the National Institute of Mental Health, in any given year, an estimated 18% of adults, 20% of teens, and 13% of children ages 8 to 15 have anxiety disorders, causing such distress that it interferes with day-to-day living. Women are 60% more likely to have an anxiety disorder than men. And the average age for onset for anxiety, just 11 years old. Now that's a lot to sort out. And here to help shed some light on all of it is Dr. Greg Mallis, a psychologist with Pine Rest. Good morning. It's good to have you here.
I'm glad to be here.
The anxiety, I know there are different kinds. Do they all present in the same way?
No, so anxiety is sort of a catch-all term for a lot of different things, and what people often don't realize is that anxiety in general is a normal, typical human emotional response to things like stress or pressure or worry. We have anxiety disorders when the anxiety that we experience becomes so problematic or so intense that it starts interfering with our ability to function in the way that we want to.
In what ways? Like, describe that.
So some people with significant anxiety or anxiety disorders worry so much about things that they can't actually get anything done. Some people have so much worry that they have panic attacks, and it feels like they feel internally like they're going to die, which is, as you can imagine, a pretty scary thing.
Also scary is the fact that onset is like 11 years of age. So
Yeah,
is there
it's
a
been getting
proclivity
lower,
in
too.
certain people to develop this disorder?
Yeah, there are some people who, as I describe, are sort of more more anxious on that anxiety spectrum. They just have that trait of anxiety. But our society really runs us in an anxious direction. We tend to worry about things as a society. We tend to worry about getting places, about doing things, about doing well, about how people will respond to us, about what people think about us. All of those things can contribute to the development of an anxiety disorder.
I imagine that in children it plays itself out quite differently than in adults, right?
Yeah,
Describe
yeah.
a little bit of that.
So with kids, they don't have the ability to describe what their experience is as well as adults do. So for kids, a lot of time anxiety is experienced kind of internally, or as we would describe somatically. So they experience a lot of headaches, a lot of stomach aches, a lot of more physical symptoms. In kids, we also see that the anxiety tends to present as more irritability or rigidness. You can probably see that in some of the kids you're familiar with, of tantrums or those sorts of things. It's not always anxiety, but if you start to see it a lot and in a regular pattern, we would start to look at anxiety as a cause for that.
What about treatment? What is it the same for children and adults and men and women?
Well, again, with adults, we tend to do a lot more talk therapy, and with kids, it's a little bit more difficult to do that. Really, with treatment for anxiety in kids, we want to work a lot with the parents to try and figure out how we can talk to our children to help them identify what some of their fears and anxieties are, and then how to deal with them more effectively.
I think conversations like this are so important because there's a lot of stigma around anxiety, which often is accompanied by depression as well, right? They often come together.
Yep, they co-occur a lot, and sometimes you have anxiety and it leads to depression, sometimes you have depression and it leads to anxiety, or sometimes you just sort of have both at the same time.
And the stigma piece probably prevents a lot of people from finding help.
Yeah, or they start to feel badly about it, and they experience anxiety, they feel badly about experiencing anxiety, and then they experience more anxiety.
And it compounds itself. Well, if you'd like to learn more about anxiety and finding help, Pine Rest has a whole section of their website dedicated to the topic. We have put a link to it on our site. Go to WZZM13.com. You'll find it there. It's good to have you here.
Glad to be here.